If you're over 60 and take a blood pressure pill every morning, there is something about hot weather you need to know. Your medication may be working exactly as it should, but on a very hot day, your body is also making changes to control your temperature. And when those two things happen at the same time, you may suddenly feel dizzy, unusually weak, lightheaded, or simply not like yourself. For some people, the first warning comes when they stand up. For others, it happens after a short walk, a few minutes in the garden, or even while moving from a hot car into the house. And the dangerous mistake is assuming, I'm just tired. It's just the heat, I'll push through it. So stay with me, because I'm going to show you 5 warning signs worth paying attention to if you take blood pressure medication during hot weather. And near the end, I'll give you a simple hot day routine you can discuss with your doctor or pharmacist before the next heat wave arrives. First, something very important. This video is not telling you that blood pressure medicine is dangerous. These medications can be extremely important for protecting your heart, brain, kidneys, and blood vessels. And you should never skip, reduce, or stop a prescription medication on your own because of something you hear in a video. The real issue is much simpler. Heat changes your body, and some medications can change how your body responds to that heat. Once you understand that connection, the warning signs become much easier to recognize. Think of your body as having its own cooling system. When the temperature around you rises, your body has to release extra heat. Blood flow shifts toward the skin, you sweat, your circulation adjusts. Your heart and blood vessels work together to keep your temperature and blood pressure within a safe range. Most of the time this happens without you even noticing. But as we get older, adapting to sudden temperature changes may become more difficult. And older adults are also more likely to live with conditions such as high blood pressure, heart disease, or kidney problems, and to take several medications every day. That's where the situation becomes more complicated. Imagine a 72-year-old man named Robert. Robert has been taking the same blood pressure medicine for years. He feels fine. One summer afternoon, he decides to trim a few plants in his yard. He's not exercising. He's not running. He's not doing anything he considers difficult. He spends some time outside, comes back into the house, sits down, and answers his phone. A few minutes later, he stands up. Suddenly, he feels lightheaded. His vision seems strange for a moment. He grabs the back of a chair until the feeling passes. What does Robert say? Well, I stood up too fast. And maybe he did. But on a hot day, that moment deserves more attention than many people give it, because Robert may have several things happening at once. He may have lost fluid through sweating. The heat may have changed the way his circulation is behaving. And his medication is still doing the job it was prescribed to do, helping control his blood pressure. That doesn't mean the medicine suddenly became harmful. It means the conditions around Robert changed, and different blood pressure medicines can matter in different ways. Let's start with one of the most important groups to understand during hot weather: diuretics, often called water pills. These medications help the body remove sodium and water. That can be very useful for controlling blood pressure and managing certain heart conditions. But think about what happens during a hot afternoon. You're already losing fluid through sweat. If you're taking a medicine that also changes fluid and salt balance, dehydration can become a bigger concern. That's why you don't want to wait until you feel terrible before paying attention. Then there are ACE inhibitors and ARBs, 2 common groups of medicines used for high blood pressure and other cardiovascular conditions. Some people even take one of these medicines together with a diuretic. During significant heat, that combination deserves particular attention because changes in fluid balance and blood pressure can increase the chance of feeling lightheaded or faint in susceptible people. Again, that doesn't mean you should change the medicine yourself. It means your doctor needs to know how you're doing when temperatures rise. Beta blockers are another group. They affect how hard and how fast the heart works, and some beta blockers may also affect the body's response to heat. Calcium channel blockers can also lower blood pressure, which means dizziness or faintness during a hot day should not simply be dismissed. But here's the key point. You do not need to memorize the names of every medication class. You don't need to become your own pharmacist. You need to know what you take, know what is normal for you, and recognize when your body begins behaving differently. And that brings us to warning sign number 1, sudden dizziness or lightheadedness, especially when you stand. Picture this. You're sitting at the kitchen table. You stand up to answer the door, and for a moment you feel as though you have to grab something to steady yourself. Maybe your vision dims. Maybe you feel as if you're floating. Maybe you have to sit right back down. Don't panic over a single brief sensation, but don't automatically blame your age either. Heat, dehydration, and blood pressure changes can all contribute to dizziness. And the most immediate danger may not even be the blood pressure reading itself. It may be the fall that happens next. A fall in the kitchen, bathroom, driveway, or on a set of steps can turn a few seconds of dizziness into a much bigger problem. So if you become dizzy, stop what you're doing. Sit or lie down somewhere safe. Move to a cooler place if you can do so safely. And don't immediately jump back up just because the feeling starts to pass. Now, warning sign number 2 may be even easier to ignore. Unusual weakness or exhaustion. I'm not talking about feeling a little tired after mowing the lawn for an hour. I'm talking about feeling much weaker than the activity should explain. Maybe you walk to the mailbox and suddenly your legs feel unusually heavy. Maybe you were folding laundry and now you feel as though all your energy disappeared. Maybe you normally tolerate summer weather well, but today something feels completely different. That's when you pay attention. Heat-related illness can begin with symptoms that seem ordinary. Weakness, headache, dizziness, nausea, heavy sweating, thirst. The problem is that people often try to negotiate with those symptoms. I'll finish this first. I only need 10 more minutes. I don't want to bother anyone. That is exactly the wrong mindset. You do not win a prize for finishing the yard work while your body is telling you to stop. If you feel faint or unusually weak in the heat, stop the activity and get somewhere cool. And this is especially important if you take medications that affect your blood pressure, heart, or fluid balance. Now, before we get to warning sign number 3, I want you to remember one simple question. Is this normal for me? That question can be more useful than trying to diagnose yourself. If you've taken the same medication for years and suddenly feel very different during a heat wave, that's information worth taking seriously. Now, warning sign number 3 is different from the first two, sudden confusion. And this one can be an emergency. Imagine you're talking with your spouse, parent, or neighbor. A few minutes ago, they were making perfect sense. Now they're confused about where they are. Their speech seems strange. They can't follow a simple conversation. They appear disoriented, or they seem dramatically different from normal. Do not tell yourself, they're probably just tired. Do not assume it's normal aging. And do not wait around hoping a glass of water will fix everything. Sudden confusion or a major change in mental status during significant heat can be a warning sign of heat stroke or another serious medical emergency. Call 911 or your local emergency service. Begin cooling the person while help is coming. Get them out of the heat. Remove unnecessary outer clothing. Use cool wet cloths or other safe cooling measures. And follow the emergency operator's instructions. This is an important distinction. Mild dizziness that improves after stopping activity and cooling down is one situation. New confusion, loss of consciousness, a seizure, or a severe change in behavior is another. Those are not symptoms to watch casually. They need urgent medical attention. Now, warning sign number 4 is a heartbeat that suddenly feels very different. Maybe your heart feels like it's racing. Maybe you notice pounding. Maybe there's fluttering. Maybe you simply become unusually aware of your heartbeat while you're also weak or dizzy. There are many reasons a person can feel palpitations, and not every flutter means something dangerous. But if a new or unusual heartbeat happens during heat exposure and comes with chest pain, severe shortness of breath, fainting, confusion, or significant weakness, don't try to diagnose it at home. Get medical help. And even if the symptoms pass, repeated episodes should be discussed with your healthcare professional. Here's why this matters. When people hear blood pressure medication, they often focus only on the number on the monitor, but your body is more than one number. Symptoms matter too. How you feel when you stand matters, your fluid balance matters, your heart rate matters, your medications matter, and the weather can become part of that picture, which leads us to warning sign number 5, signs that you may be getting dehydrated or losing too much fluid. This can include a dry mouth, strong thirst, dizziness, weakness, or noticeably less urination than usual. Urine that becomes unusually dark may also be a reason to pay attention, especially when it appears with other symptoms. But don't use urine color as a perfect home test. It isn't one. The bigger question is whether several warning signs are appearing together. For example, it's extremely hot, you've been sweating, you're taking a diuretic, you're lightheaded when you stand, and you're urinating much less than usual. That combination deserves more attention than any one symptom by itself. Now you may be thinking, fine, I know the 5 signs, but what exactly should I do on a hot day? Here's where many people make another mistake. They wait until symptoms appear before making a plan. A better approach is to prepare before the hottest part of the day. Start with your medications. Know the names of what you take. If you don't know whether one is a diuretic, beta blocker, ACE inhibitor, ARB, calcium channel blocker, or another medication that could affect heat tolerance, ask your pharmacist. That's what pharmacists are there for. A simple question can be enough. Does anything I take require extra caution during very hot weather? Then ask your doctor whether you need a personalized hot weather plan. This is especially important if you have heart disease, kidney disease, a history of fainting, or you've been told to limit your fluids. Notice what I did not say. I did not say, drink a huge amount of water. I did not say, take extra salt. And I definitely did not say, skip your blood pressure pill. Those blanket instructions can be unsafe for some people. A person with certain heart or kidney conditions may have very different fluid needs from someone else. Your plan should fit your medical situation. For many people, staying adequately hydrated is important during hot weather. But if your doctor has ever told you to limit fluids, follow your personal medical guidance and ask what you should do during extreme heat. Next, plan around the temperature. If the day is expected to be extremely hot, move outdoor chores to a cooler part of the day when possible. Don't wait until the sun is blazing and then decide it's the perfect time to wash the car, pull weeds, or take a long walk. And be careful with a common trap. People think, I'm only going outside for 10 minutes, but 10 minutes becomes 20, then 30. Then you realize you're hotter and more tired than you expected. Make cooling part of the plan before you begin. Know where you can go. Use air conditioning when available. Spend time in a cooler indoor space during dangerous heat. Wear lightweight, loose clothing. And if you begin feeling faint or weak, stop what you're doing. Do not push through it. There's another simple habit that becomes particularly useful if you live alone. Tell someone when you're dealing with unusually hot weather. It doesn't have to be dramatic. A son, daughter, friend, neighbor, or relative can simply check in. How are you feeling? Are you staying cool? Any dizziness today? Sometimes another person notices a change before we do. Now let's talk about home blood pressure monitors, because many people over 60 already own one. A home monitor can provide useful information, but don't become trapped by individual readings. Blood pressure naturally changes, and if you get one unexpected number, sit quietly, follow the instructions for your monitor, and repeat the measurement appropriately. More importantly, know the range that your own healthcare professional expects for you. Don't borrow somebody else's target from the internet. And never change prescription medication just because of one home reading unless your healthcare professional has already given you specific instructions for that situation. If you repeatedly get readings that are unusual for you, especially along with symptoms such as dizziness or fainting, contact your healthcare professional. Now here's something else worth remembering. Hot weather isn't only about standing outside under direct sunlight. You can become overheated indoors. A poorly ventilated room, a hot apartment, a garage, or a parked vehicle can expose you to dangerous temperatures, and adults over 65 may not adjust to sudden temperature changes as easily as younger adults. That's why the person who says, I've lived through hot summers my entire life, may still need to take more precautions today than they did 20 or 30 years ago. Your body changes. Your medications change. Your medical history changes. Your response to heat can change too. And none of that means you should be afraid of summer. It means you should respect it. So let's put everything into one simple hot day checklist. Before a very hot day, know what medications you're taking. Ask whether any of them require special precautions in the heat. Know whether your doctor has given you any fluid restrictions. Plan outdoor activity for a cooler time when possible. Have access to a cool place. Keep your phone nearby. And know your personal warning signs. During the day, pay attention to unusual dizziness, weakness, heavy sweating, nausea, changes in urination, or a heartbeat that feels very different. If you feel faint or weak, stop the activity and cool down. If symptoms are new, significant, repeatedly returning, or concerning, contact a healthcare professional. And if someone develops sudden confusion, loses consciousness, has a seizure, or appears severely ill during heat exposure, treat that as an emergency and call for help immediately. There's one more mistake I want to prevent before we finish. After hearing all of this, someone may think, maybe I should just take less blood pressure medicine when it's hot. Please don't do that. Your medicine was prescribed for a reason. Stopping it, skipping doses, or changing the amount without medical guidance can create an entirely different set of problems. The safer question is not, which pill should I stop? The safer question is, what is my personal plan for very hot days? That one question can open an important conversation with your doctor or pharmacist. You can ask, do any of my medications affect how I handle heat? What symptoms should make me call you? How much fluid is appropriate for me? What should I do if my blood pressure is unusually low and I feel dizzy? Is there anything different I should do during a heat wave? Those are useful questions because they turn vague worry into an actual plan, and that's the real message of this video. Your blood pressure medication is not suddenly your enemy when summer arrives. It is still doing the job it was prescribed to do. But extreme heat can change your body's fluid balance, circulation, and ability to stay cool. For some people, that means symptoms can show up that deserve attention. Remember the 5 signs we covered. Number 1, new or unusual dizziness, especially when standing. Number 2, weakness or exhaustion that doesn't match what you've been doing. Number 3, sudden confusion or a major change in mental status, which can require emergency help. Number 4, a new or unusual heartbeat, especially when combined with serious symptoms. And number 5, signs that you may be losing too much fluid, such as dry mouth, dizziness, weakness, or much less urination than usual. You don't need to be frightened by every warm day. You don't need to constantly check your pulse. And you don't need to stop medicines that may be protecting your health. You simply need to recognize when your body is asking you to stop, cool down, and get help. And sometimes the most important thing you can do is share this information with someone else, because maybe you're careful during hot weather, but your father still spends every afternoon in the garden. Your mother doesn't like turning on the air conditioning. Your neighbor lives alone. Or your spouse takes several medications and has never asked whether heat changes anything. Send this video to that person, not to scare them, to give them a question they may not have thought to ask. And before the next very hot day arrives, consider taking your medication list to your doctor or pharmacist and asking one simple thing: what should my hot weather plan be? That conversation can give you guidance specifically designed for your health instead of generic advice from the internet. If you found this useful, subscribe, because on this channel, we're going to keep breaking down the health questions adults over 60 often wonder about, but may never have had explained in simple language. No panic, no miracle promises, just practical information that helps you ask better questions and make safer decisions with your healthcare team. And remember, if you develop sudden confusion, fainting, a seizure, severe trouble breathing, chest pain, or another serious symptom, don't wait for a YouTube video to tell you what to do. Seek emergency medical care. Stay informed, stay cool, and take care of yourself.